Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Durr, and I will be your host for today's episode. We have Jessica Scruton here with us. Jessica is a registered nurse with CCM certification and is an advisor of our clinical transformation team here at Lightbeam Health Solutions. The topic we will be talking about today is diabetes detection and management. To start us off, Jessica, can you give us a little bit of background about who you are, what you do, and what your role at Lightbeam is?
Thanks, Laurel. So, like you said, I'm a clinical transformation advisor here at Lightbeam. Clinical transformation is a branch of the advisory services team. So we work closely with the clients throughout the development, implementation, and deployment of their population health initiatives. Specifically, we work around their goals for care management and patient engagement. So we build the programs for the clients with targeted outreach using, in short, the power of the data. Clinical and financial insights coupled with a background of patient population gives us everything we need to get to work.
Awesome. So like I said, today's topic is diabetes management, since November is Diabetes Awareness Month. We decided to speak with you not only because you have a nursing background, but also you have a ton of experience working with our clients and implementing these patient-centered programs. First, I'd like to ask, what are some important things that you know about diabetes?
Well, to start off, I think it's important to understand that there's different types of diabetes, specifically 4 different types. You've got type 1 diabetes, which is your juvenile diabetes. Type 2 is typically adult onset diabetes. There's also gestational diabetes and prediabetes. Each is slightly different, but all forms of the untreated diabetes can cause complications. With proper management of diabetes, you can live a completely normal life. Avoiding excess carbs and sugar, exercising regularly, and staying on top of your medication and insulin is critical for individuals with any type.
Are there ways to prevent or reverse diabetes?
It depends on the kind. For instance, gestational diabetes is specific to pregnancy, so it's a pregnancy-related condition, and that typically goes away after delivery. But I will say women that develop gestational diabetes are more likely to develop type 2 later in life, so it's always best to be aware that that's something to look after and take preventative steps early. With type 1 and type 2 diabetes, those can't be cured. Type 2 can be reversed if it's managed appropriately. Just to note, reversed does not mean the same thing as cured. It just means the person doesn't have to insulin as often or check their blood sugars as often throughout the day. The other one that I mentioned that we haven't talked about yet is the prediabetes. So prediabetes is a condition that occurs before diabetes. It's like a warning sign to individuals that they need to make some lifestyle changes so they don't become type 2. So according to the CDC, 90% of people do not know they have prediabetes. Having prediabetes, these individuals will have a higher blood sugar level than normal and maybe right on the edge of being dangerous, so they'll have to act before it progresses.
So that kind of leads me to, what is a diabetes management initiative that value-based care can achieve?
Determining the appropriate diabetes initiative, you really have to consider a few key points. So the first is targeting those pre-diabetics that we talked about, as well as the rising risk and the moderate risk population. The part of the population that can be managed with a low-touch, high-impact approach. For example, you're using data to identify anyone that has not had an annual wellness visit, maybe anyone that does not have a primary care physician, and who does not flag as a high utilizer would be this perfect subset of a population for targeted campaigns on regular care. Detection and prevention reduce the risk of reactive management, which is something I always stress when it comes to diabetes management. So the second is finding high-risk, high-cost diabetics. This group of diabetics are the individuals that are best managed with a high-risk care management model. One thing to highlight is that diabetes causes systemic complications that can impact every part of their body. A diabetic can experience anything from neuropathy to skin problems, eye issues, high blood pressure, increased risk of stroke, and others. Lightbeam allows us to target specific action items using the quality measures and the ability to view open care gaps. So, for example, if we identify a group of high-risk diabetics, we can pinpoint exactly what is driving their high cost using clinical, financial, and utilization data. We can see if there was any care coordination done for them and build action items around the care management workflow from there.
Thanks, Jessica. What are some common barriers that prevent patients from caring for their diabetes?
So the barriers that patients face in caring for diabetes are synonymous with other disease states. It's typically resources, social determinants, knowledge deficit. These are all plausible examples of things that could impact how one cares for themselves. But there are two things I really think are important to point out. I have found that in working with patients in all settings over the last 20 years that diabetics don't always know the impact of their condition. I had a patient I looked after in the ICU with a massive infection in their surgery site. In talking with that patient, I quickly realized that they had no understanding of blood sugar control and wound healing. They didn't understand the complications that take place post-op with poorly controlled blood sugars, or that how stress alone of surgery can cause variances in their blood sugars. The patient needed education on not just why it happened, but what to do to prevent it and how they needed to change their behavior. Had that conversation with the patient taken place pre-op, it is possible the entire situation could have been avoided. So the other piece is behavioral health and caring for chronic conditions are not mutually exclusive. When a patient has an undiagnosed or untreated mental condition, this makes managing the diabetes or any other chronic condition for that matter extremely difficult. So to put it simply, if someone's struggling to get out of bed and do their activities of daily living, or they're struggling with depression, the likelihood of them adhering to blood sugar monitoring, diet requirements, and any of the medications that the physicians have prescribed for them are pretty low. We can talk more about that in our December podcast focused on behavioral health, but really wanted to highlight that managing the behavioral health is primary to managing all aspects of health, including the diabetes.
So then what would you say Lightbeam clients can do to manage large populations with diabetes?
So understanding what your high-risk population is, as well as what's driving them to be high risk for the diabetics, using targeted approaches. So you can look at the clinical data and see if there are care gaps for annual wellness visits. You can see if they're high utilizers of the ER, understanding what the pain point is and using that as a driver for creating the campaigns or the initiatives. The moderate risk and rising risk population usually works best when you're doing a lower touch type of campaigning. So really targeting them for some sort of moderate risk and rising risk, targeting them for chronic care management and disease management, helping them understand how to use their resources that they have available to them. The biggest thing that you can do, especially with the pre-diabetics, which are your individuals that may not have been diagnosed or even come onto the radar of the high risk or the rising risk, is to promote the annual wellness visits. Getting individuals in to be seen before they're sick is a proactive versus reactive approach, and that's something that you can utilize the Lightbeam data for as well. Another thing that the Lightbeam clients can do using the data and the information in the application is to modify the approach when needed. So if they've identified an initiative and they don't think that they're quite targeting the right population, they can continue to analyze and look at the engagement to see if they need to shift their focus into a different area. But again, don't be afraid to be innovative and customize solutions to your population.
Thanks, Jessica. If some of our listeners are interested in getting more information on diabetes management, where would you suggest they go to find additional resources?
Always use your medical providers first to ensure you're fully educated on what treatment plans look like for you. The American Diabetes Association is an excellent source of information for all things diabetes. There's some fun things out there available as well, from cooking classes, diabetes focus, to fun runs to raise awareness.
I will provide links to these below, and Jessica, I really appreciate you joining us today. You provided a lot of really good information on managing diabetes.
Thank you. Thanks for having me.